Good afternoon, everybody. Thanks again for joining me for another town hall meeting on Wednesday at 2 o'clock. It's been a weekly gathering for I'm not sure how long. I was going to look back today to see how long we've been doing this, but it seems like quite some time now. I know we didn't start at the very beginning, but as things started ramping up and they got a lot of more information from the state and from associations, and so I had to start making changes. As when we thought about doing this, I believe it was Leah's idea. She thought it'd be a good idea to do this and to be seen, and I thank her for that because I think it's turned out to be really well, and I've got a lot of positive feedback. So first of the month, July 1st, and we're still going strong and still have some developments and some news. So we'll get to that here in just a second. I want to talk a little bit about, just kind of preface some of this about what we're seeing nationally and locally. I'm sure most of y'all keep up with the news probably much more than I do, but I do know yesterday I believe the nation had the highest one-day record of new cases of over 44,000, and I think today North Carolina had their highest day total of 1,843 positive new cases. So I've said it once, I'll say it again and continue to say it. I think a lot of this is just correlation with what we're seeing in our state and in the country. It's just a nasty virus that just spreads like wildfire once it gets into a place, and it's just, you can be super precautious and never get it, or you can be super precautious and get it. There's rhyme or reason to it, but a lot of the residents and employees that have tested have been asymptomatic and are still asymptomatic the entire time, had no idea they had it, don't feel bad, would have never known if we wouldn't have done mass testing. So it is an odd thing, but at least we have more testing available now. We're getting results quicker, and in turn helps us make decisions quicker and address it and get people feeling better much quickly, which is both residents and staff. So again, just continue to see those high numbers. I don't know when that will start to decrease. I see a lot of states are pulling back and doing things, going back to their original phases or shutting restaurants back down. I have no idea if that will happen here or not. But again, I think we can just never be too safe. I think that we just need to continue to be very diligent in what we're doing about safety precaution, washing hands, wearing your mask anytime you are in public. So that is in the hallway, it's in a grocery store, it's basically any time that you're either not in your residence alone or with family, or whenever you're outside 6 feet apart. I won't recap all what I said earlier. Again, it was just continue to do the town hall meetings and kind of the rising numbers in the state and the nation. I think just kind of a correlation to what we're seeing, here at Springmore as cases continue to rise. So I want to make sure, so I think you guys can hear me now. So again, that was just a little preface about what I'm about to say. So got some good information to share and some not great information to share, but not bad information. But I want to first start off by talking about the chart that we've been doing up on the portal. I hope that's been helpful for y'all to see where we are in real time. That's updated daily, and it has both residents, and it's got employees, and it's got the area that they're in, that they live in, and it's got the total number of tests administered. And I think that's very, very important to see the amount of tests that we've administered and the number of positive cases that we have come back. So as of our most current chart, we have a total of 15 positive cases right now, 8 being staff members and 7 being residents. Now again, that could change today or tomorrow, but right now that's where we're at. I will say that we had 3 employees come off since we started doing this. So the first ones in the health center that we identified, I guess 2 weeks ago, whenever we did this, 3 are already off. 2 more residents and 3 more are supposed to come off by this Saturday. So again, 3 have already come off, and then 3 are supposed to come off by Saturday. They were originally quarantined. Now again, that may it may kind of be a wash, or it may go up or down based on any new cases we get. But that is good to see that we're starting to see people get better and get back to work. And also, we have 2 residents that are coming off tomorrow, off quarantine. That was originally 2 in the health center, and we have 2 more scheduled for Saturday as long as they continue to show improvement. So that will be a total of 10 people. 10 people that we have had come off, 6 employees. 3 already, 3 scheduled for Saturday, 2 residents tomorrow, and 2 for Saturday. So I'm pleased with that to show those results, and you can kind of see that decline in those aspects. I think it was as high as 18 at one point. Yes, it was, because we've had the 3 employees were the first 3 to come off. So it's been as high as 18 and now 15, and then we'll kind of see where it goes in the next few days. And you'll see on the side the number of tests, 323 tests administered, and of active cases, that's 15. If you do the math on that, that's 4.6% of positive cases. So if you look at it that way, that's pretty incredible to administer 323 tests and to have 15 active cases right now. Even when we had 18, it was right at 4.9. I did the math on that, I believe. So still less than 5% at any one time. So it's kind of the way you look at things. I can assure you that if any community such as Springmore did 323 tests, they're going to get the same, if not more. And we're going to see that here soon, because if you've also followed the news, and again, I don't want to see that. I don't want to see anybody in the world get sick again. I'm just afraid that's reality, and we're going to see and hear more about it, because in the news yesterday, it was going to be required that all long-term care facilities have all residents and staff tested. So that is going to be a new requirement. And but we're already ahead of the curve, and we've already done that. So if you have done that after May 18th, do not have to do it again. We're not planning on doing that again. We have a good baseline, and then we'll tackle it from here. Once someone tests positive, they can test positive again up to 48 days. So we have a good feeling of where we're at. Everybody's being checked daily for symptoms. That includes residents and staff. So again, it's a lot of tests we've administered and a small fraction of people that are positive. Now, it's 15 people too many, but it's, again, a small amount. So it'll be interesting to see what other communities come up with in positive cases when this happens. Remember, 2 or more is considered an outbreak. Again, that's a little, an outbreak's a little harsh word, I think, for 2 people, but that's the way they phrase it, and they're always good about reminding you it is 2 or more, and they don't tell you if it's 15 or if it's 2. So for all we know that, everybody thinks we're still at 2 people. Again, it doesn't matter if people know if we have 15 or if we have 2. It's reality. We're tackling it. We're handling it, and it's nothing to be ashamed of. I cannot tell you anybody that's given 323 tests to residents and staff. And I'm not saying there's not any. I don't know of any. We have an extremely large health center. I've said it before, 120 residents, over 250 staff members. We did approximately 120 tests on, let's see, I have it right here. We did 120 resident tests and 203 employee tests. So you may say, well, what happened to the other 40 some odd employees? Well, some of those are part-time, they're PRN, and some of them don't work very often. So if they have not worked for a certain amount of time prior to this, we didn't require them to be tested. But they're still on our payroll, and they still will work from time to time. Now, so that's where the 203 comes in. But again, 323 tests already administered. So again, it's just an incredible number to see only 4.6%. Again, we hope that continues to trend downward, and we'll continue to do the best we can. I think in all reality, my expectation is to get over this little spike we had and get it down to a minimal amount. And then if 1 or 2 cases pop up here and there, I think that's going to be expected, and I think that's going to be the norm. I have no idea if that's right, but I think that's a reasonable expectation only because the cases continue to rise. There's no clear end date for a vaccine yet, and I don't think it's going anywhere. And it seems to be it's pretty darn hot outside, and if it gets colder, it just seems that it will be even more. So they're talking about second waves. So I just think we all need to be realistic about where we're at, and as much as we don't want to admit it or see how things are going, they're not going in a good direction. But my main concern, like I've always said, is Springmore. I have no agenda other than making sure y'all are taken care of and safe, and so of our residents. So that's my main focus, and that will continue to be my main focus. So we'll see those continue to hopefully drop. What I did want to share was in supportive living, we are going to be tomorrow testing all the residents and staff in supportive living. One of the staff members that recently tested positive works every other weekend in supportive living. So we thought that would be a good idea to test everybody. We were talking about it, and then as early as today, we started doing wellness checks twice a day, where they're checked, they have their temperature taken, and then we do respiratory O2 stat tests every day as well by a nurse. So they're checked 3 times a day, and one resident and one employee are beginning to show symptoms. So we tested them today. We do not have their test results back, but I felt it was just best practice to be super precautionary and go ahead and test all the supportive living residents and the staff. We only have about 35 residents down there and a very small staff. You know, there's not a big staff down there, but we do have some dining and other people that work down there. So to be proactive, we're going to have Mako Labs come in again tomorrow and test everybody. They're in a small group down there. They've been eating in the dining room together down there. So I think it's just best practice to go ahead and test everybody. I have learned since doing the health center, you get one positive person, and then the other one gets it, and you trace it, and then you test 15, and at the end, you end up testing everybody. So I wouldn't change the way we did it, but moving forward, I think once we get 1 or 2 positive cases, it's in an area like that, that they're closely connected, that we just go ahead and test everybody. So again, we're going to do that tomorrow. Not sure how the results will come back as far as time-wise. Mako, who we use, is gained a lot of popularity and getting a lot of business. Wake County has actually contracted with them to do all COVID-19 tests. I think I mentioned early on that when we reached out to the health department to do the test, they didn't have a strike force big enough to come out and do communities like this. So now that they're requiring every nursing home in the state to be tested for all residents and all employees, they have contracted with CVS Health and also with Mako Labs to actually administer the test. At least Wake County has. I think the state of North Carolina is contracted with CVS, but I think Buncombe County and Wake County is contracted with Mako. They're out of Henderson, actually, so they're somewhat of a local company, but they've been great, so we're going to continue to use them, but we're seeing the results come back a little bit later. We were seeing 24 hours or less at first, but now we're seeing them up to 72 hours delays. So when we report a new case and we had testing on Friday and you're not finding out about it until Monday, it's just because we have not had the test results back. Kerry Corley is our healthcare administrator. He gets called personally with any positive case, and there's a portal that you can go and check and see what's pending, see what's already been active or inactive. So that's how we keep up with our chart each day, and he keeps up with that over the weekend as well and keeps everybody informed that needs to know. So again, we'll be doing that tomorrow, and I think that's just best practice to be proactive in doing that. And of course, we'll report anything that happens from there. I think I've talked the most about everything moving forward, about, just trying to reduce everything to be minimal exposure. A case here and there I think is probably realistic. I would hope y'all think that's realistic as well. Just with everything you hear, it's just tough. It's almost impossible not to contact it from somebody possibly, or know somebody that has it. It's just like a chain reaction, So, But anyway, we'll do our best to move forward with that. So I got a few announcements, and after that, I'll take any questions that we normally do at the end of the show, is 7054, and I'll answer everything as best as possible. But I did want to go into a couple of announcements here. Get past all these graphs. I had all this information on. All right, so we have an important announcement about the mail. Just a reminder, if you're going out of town for the holiday weekend, please have a friend or resident get your mail or call the post office to put your mail delivery on hold. We cannot handle all the requests coming into whole mail delivery. We just don't have anywhere to store it. So just be mindful. We do that a lot of times. We go out of town, stop our mail. When we used to get the newspaper, we'd stop or have it donated. Yeah, we'd usually donate it somewhere. So anyway, just stop your mail if you're going to be out of town for a long weekend or for a week. It's just we get such an abundance of mail, and we've talked, about. Some people have asked, well, when are we going to let the mail guy come in and just let him come in and not be screened? I thought about that for a while, but right now, I just don't think that's the right thing to do. That scares me way too much of somebody being out in the public like that and not coming in, even though they're not around anybody. I can control that, and as long as I can continue to control that situation, I believe we're going to stick with what we have, because I would feel terrible if that somebody just came in and I knew they wasn't screened. So we're going to keep that the way it is now, but just be mindful. We got amazing residents that are dedicated to help do that, and Lee and her staff have been tremendous too. So. That's with the mail. Physical therapy, Farida, a lot of y'all know Farida. She's the main PT down there, and Nancy, she's the manager. They wanted me to remind everybody of this. So she said, please inform all residents that the South Village Wellness Center and the physical therapy in the South Village Wellness Center, that the physical therapy team has taken every precaution to avoid any type of sickness or potential of spreading the virus. We are not treating the first floor patients in the health center right now, and we're wearing PPE, face shield, goggles, etc., taking temps, completing forms, sanitizing, cleaning equipment, washing hands, using hand sanitizer. I think they covered everything. I saw one of the physical therapists in the hall yesterday wearing a face shield when they were walking with a resident. So that's great precaution, and they are doing everything, as you can hear from that. Just want them to know that we're doing everything we can to keep them safe, and they wanted to pass that along. That's from Nancy and Frida in physical therapy. So as you can hear, they're on top of it. Got some updates about fitness. So something people have been wanting to hear, we'll get to in a second. But first, the Wellness Center and pool schedule is now available online, and it is done through a Sign Up Genius. I'm not sure if y'all are familiar with that, but it's pretty easy to do. It's if you look under important links on the portal, on the pathways, important links under the pathways portal, click on Wellness Center Pool Schedule. So over on the left, you'll see all those tabs and say important links. Click on that. Then you'll see another subsection that says Wellness Center Pool Schedule. It will take you to the website where you can see the schedule and you can make reservations. Just type in your name, just like you would do ordering a meal or anything that you normally do on the portal. Is really simple, really easy. If you're using the portal, you will know exactly how to do that. So again, that is for the Wellness Center Pool Schedule on the resident portal. Also, we've had some requests about the North Village Fitness Room and opening that up, and we're preparing to open that up on Monday, July 6th. Again, Monday, July 6th, so this coming Monday, we're going to open that. We've had to work out some logistical stuff, and I think we got it squared away now. So 3 key points. At this time, only one resident may be in the room at a time. It's a pretty small room, so we feel that's the best due to the square footage. There are a few exceptions that will be outlined in a detailed memo, so you'll see that from Carrie Ritchie, so be looking for that, but that's kind of the main guidelines of one person. Residents who would like to use the fitness room between the hours of 8 a.m. and 5 p.m. must sign up on the appointment board located outside of the fitness room. Again, this is only in North Village. This will be available by the end of the week. So by the end of the week, there'll be a schedule outside the North Village Fitness Center, right through the breezeway, right on the right, that you'll be able to sign up. Appointments will be 45-minute increments, and that will also allow time to be for the equipment to be cleaned before the next person comes in to exercise. So 45-minute increments plus cleaning time. Each resident is responsible for cleaning the equipment they use before they leave. Cleaning products will be provided in the room. So I know that's what they're doing with the 2 machines in the great room and also the 2 machines in the terrace room over in South Village. So if you are if you're using those pieces of exercise equipment, make sure that you're cleaning them. That's your responsibility to do that, to make sure that you're keeping your fellow residents safe and that any germs you may have that is completely being wiped away. So that's your responsibility, kind of similar to picking up after your dog, I guess, if you're going for a walk. Just do your due diligence with that to keep everybody safe and clean up whenever you're done. And lastly, the new step in recumbent bike. I guess is that a fancy word for just an exercise bike? Carrie? A seated bike, a recumbent bike. That's way over my intelligence level. The new step in recumbent bike will remain in the North Village Great Room and South Village Terrace Room. I just mentioned those, so I guess a seated bike, which is just a stationary bike, but we refer to it as a recumbent bike, will remain in both North and South Village in those 2 rooms. So make sure if you're using it, please clean it. All right, getting close here. Got some announcements from the chaplains. In the month of July, we will begin small group gatherings of 10 or fewer. These will be in-person gatherings. So please call the hotline at 7700 for your reservation. Again, that's 7700 to make reservations for any of the small group gatherings for the month of July regarding the chaplains. Some of the stuff they have going on, Connections Discussion Group. That will be Thursday. That's tomorrow, actually, July 2nd, 10:30 in North Village and 3:30 in South Village. So people can go ahead and call for that now, Lori. So you can call for that, 10 or less. Get on it. It's going to fill up fast. Discussion groups. North Village at 10:30, South Village at 3:30. No Zoom meeting this week. That's unfortunate. It will be held on July 9th. Looks like the chaplains are taking the 4th off. Is that true? They're not. Alternating weeks with the group. Thought they were going to watch a fireworks show somewhere, but that is not the case, especially at 10:30 in the morning. So no Zoom this week, but we'll catch up next week, July 9th. Vespers will be Sunday as normal. Sharon Schultz will be preaching. Is she a local pastor? Lutheran local. I like that. I grew up Lutheran, and I like local stuff. You know, I'm a Baptist. I'm not a Baptist now. I'm a Methodist. I don't know what I am at this point. I'm brain dead. But Sharon Schultz will be preaching Vespers at 7 p.m. Chaplain movie matinee Monday, July 6th at 2 p.m. with Moonstruck. And then a Bible study that continues Tuesday, July 7th at 3 o'clock, Faith and Fear. So I bet that's really good. Seriously, I bet that's good. That would be interesting to hear during this time. So lastly, I had a question or a comment from a resident that I wanted to read and address, and then I will take any of your questions that you have. So this comes from an anonymous resident. It says, your memo on June 24th states that home care workers will only work either in the health center or independent living. That's correct. So we split them up to where they're only working either in the health center or independent living. Hopefully that will prove us well and hopefully lessen the spread of the virus. Several residents have heard from housekeeping staff that weekend housekeeping staff from independent living areas are being used as a substitute in the health center. What is the difference between the two workers in terms of the possibility to spread the virus into independent living? Please explain in the next town hall. It's a great question. Well, first of all, I will tell you that is not happening. It was at one point happening, but that's not happening now. Without getting into much detail, those workers are not going into the health center. That was a common practice. We use them as floaters on the weekend to clean common areas and to clean rooms if needed. For one reason or another, that has not happened for at least about 2 weeks. So if you have any questions about that or any more specific information, you can give me a call. But I have worked with Terry and talked with her today, and that is not happening anymore. And it's been at least 2 or 3 weeks since that has happened. But what is the difference between the two workers in terms of possibility? That's hard to tell. I would think it'd be less possibility, but I have no idea. If they're floaters and they're working in common spaces and residents are mostly quarantined to their room, it's less exposure to people than an actual CNA or home care worker actually giving patient care. So there's no hands-on care, there's no assisting with lift, there's no bathing, there's no dressing, it's just cleaning a room. So I would think it's less, but the way the virus spreads, which is really odd, it may not be any less. So the point is that it's a good practice to keep everybody in separate areas now as much as possible. And that is happening now for housekeeping and with home health. So great question. Thank you for bringing that up, whoever the anonymous person was. I hope I answered that well. And I'll be happy to take any questions that y'all have. I think we got some already. Why are we? Okay, so the question is, why are we using plastic dishes? I think we've been using those since the kitchen renovation, so that hadn't changed unless I'm totally wrong, but we're using plastic dishes because we didn't have a dishwasher in the mobile kitchen. We purchased a brand new dishwasher that is actually being installed now and custom fitted to our new scullery department. Did I say that right? Isn't scullery like a fancy word for like a dish room? I think it is, or a kitchen. Yeah, I heard a boss say that one time. He's a smart dude. So basically our dish room, scullery. Tell me if I'm right or wrong. Somebody tell me if that scullery means like a dish room, if you want to call. But yeah, that's why we're using plastic plates. We don't have a dish machine. Once we get back into the kitchen, which will hopefully be pretty soon, I'd said today. It's not today, but it's it's almost close to being there. We will be back to regular silverware, regular plates, cups, tablecloths may or may not happen right away, but plastic plates because of the kitchen renovation. That's a good question. So the question is, since the health center residents are confined to their room, are we still doing window visits? We have suspended window visits for now because we're trying to, keep people in their room, and we're trying to keep the residents from first and second floor going up and down. Right now, all the cases for residents in the health center have been on the first floor. I'm 99.9% sure there's not one resident that has tested positive that is on the second floor. So to do a lot of window visits, to do all the window visits, we have to bring them down to the first floor, down certain hallways to certain areas. So since we have had recent cases, I think we have 8 or 7 now, I just said it earlier, we felt it was best practice to stop those until we have less cases, or we can contain it maybe to a certain hall. I know that they're in an isolation wing, but we just tested everybody. A lot of the people that are now coming, that are showing positive now were tested 2 weeks ago, but now they're starting to show symptoms. So now we're identifying people based on symptoms. So until the cases drop and we feel good about it, we want to keep the residents in their room to kind of curb this spike for now. So is all staff wearing, is all staff in the health center, including administration, wearing masks? Yes, they very well should be, and I hope so. I am very confident on the floor they are. We've talked about this being a requirement, about wearing masks all the time in public places, but do we even wear them if we're interacting with somebody in an office when we're more than 6 feet apart? I've not mandated that for any staff members yet, but I can tell you anytime that I'm in a conference room, just on Tuesday Monday actually, doing a call with 5 other people in the conference room. We all had our mask on. Last week we did a management advisory committee in this room. We had 10 people, all pretty well spread out, but not terribly far. Everybody kept their mask on. But yes, all the health center people are wearing their mask. even administration, that is preach and preach and preach and preach. So I cannot put my life on the line saying everybody has their mask on every second, but they darn sure better have it on, yes. So the question was, is there going to be a yard sale this year? Miss Peg Bedini will be the expert on that, but if I recall, I believe I remember seeing some notes, and I don't know if she wants me to announce this or not, so I won't give any specifics other than it has been postponed for now. I think it is set for a later date in the fall. Wishful thinking and hopeful thinking that we will have it in the fall, but we're hoping to still have it, but it's been pushed back into the fall. The question is, when is the new kitchen supposed to open? We hope soon. We're hoping that they're wrapping up everything. I said by the 1st. They're still cleaning some equipment that we had to put back in. We're pressure washing and deep cleaning all of our current equipment before we put it in. That got put behind a little bit based on the crew that we had to have conduct that. But I think most of the work is done. Once we have, I've already given a 30-day notice to the Kitchens to Go crowd, which is our mobile kitchen, so they know that we are ready to move forward with dismantling that. It just as soon as we get the okay, we can't do anything until the building inspectors come out and improve it, and then when the county inspector comes out and approves it, but it should be very soon. I'll be honest, I've not received an update this week. I usually get a weekly update from the contractor, but with everything going on, I've just not reached out yet. But I'll try to do that before the holiday. So the question is how, if residents are subtracted from the chart that Margot sends out, how will we know there's a new case? That's a great question, and there's really not a way to do it unless you keep tally every day. We have decided the easiest way and the best way for everybody to see it, including staff, is to know the active cases. So if you need to know specifically of a case, so for instance, supportive living. So we had an employee that tested positive in supportive living. So all those residents specifically know via memo, and all their family members going to know via an email. That has not went out yet. This went out to the residents because we made the decision earlier today, to go ahead and test everybody. So you're just going to see active cases. We don't have a history on here. As I said before, we've had more people on here, but we're just doing the active cases, so you just kind of have to tally it. We're not doing new cases. It gets really kind of cumbersome, and it's not an excuse. It's just the amount of reporting we have to do to the state and the amount of reporting we have to do internally that we try to keep this as simple as possible for our staff and for y'all just to see where we're at. It's a snapshot in time, and if there's anything specific you need to know, that we'll make sure that y'all know. Are employees in the clinic being tested? I do not have the answer to that. I think they were tested with the health center residents, but with the health center employees, but I could be totally wrong. I think we did. I know we tested all the home care workers. That's how we found out one of the home care aides who works every other weekend in supportive living came back with a positive test. So I think they were tested initially, but Holly will find that out, and we'll put that in the recap memo. So the question is there any plans to test independent residents? No, not at this time. I really pray that nobody in independent living gets it, but if it becomes that, we'll have to tackle that when it happens. The health center is much different. It spread so quick there, and it's a licensed area that we were pretty much told by the health department. Well, we were told by the health department that we had to test everybody. They're not going to require us to test all the independent folks. Not that we wouldn't, but that would probably be more of a tracking contact tracing like we did with the first housekeeper. We would probably try to contact trace everybody that maybe was around a resident that tested positive. And then we would take it from there and just make sure that, and we may quarantine a couple of residences down or up for safety reasons, and just for everybody to be on heightened awareness about reporting any symptoms. But I don't foresee us testing in massive independent 475 residents at this time. But hey, never say never. I have no idea if that will happen, but hopefully not. We would contact trace. Okay, that's a good question. So, were all the residents that all the staff that tested positive, were they health center residents, or were they the independent independent staff? Some were both. So we tested the majority of everybody. I'd say at least 13, maybe 14. They're mainly workers in the health center, nurses, housekeepers, CNA, GCT. But we did test everybody that has any contact. For instance, I got tested. So all the health center administration people got tested. I'm not necessarily a health center employee, but we had a few other department managers get tested that actually work with staff in there and actually go back there. So we kept them in the staff cases for the Stewart Health Center only because they do go in there from time to time. It was too confusing for independent living, and everybody's, well, who's in independent living? And well, it's the person is not interacting with people. They don't actually work in independent living, and they don't work in the health center. They're more of a supervisory type role, so which does have some oversight in the health center. So no actual independent employee yet, other than the first housekeeper we have, and then we have one that is an employee in supportive living that is being tested, but they would go under the supportive living column there in the graph. So the question is, how do we control the supportive living staff? Staff, employees, I don't even know who's who. How will we control the supportive living residents since they do not have locked doors? We're going to do the best we can with that. You're right, they're not locked doors. All the staff is aware. All of the administration is aware, and we have we quarantine them to their room. We're delivering their meals. They're all going to be tested tomorrow, and we just have to keep a close eye on them. We know the ones that are more apt to, quote unquote, wander down the hall a little bit, and we've got to do the best we can with that. We may come up with something a little bit more clever than what we have now, but we're just all this is just kind of unfolding as of a little bit before lunchtime. So I don't have a specific answer of how we'll do that, other than we're going to just monitor them closely the best we can. The question is, if we can show movies of 10 people or less in the auditorium, why can't we do it in the theater and on 1341? I believe there's some restrictions with the theater over in South Village. I know it's not an actual real theater, but it has some type of license, and Leah maybe can better answer that. But I think we have a motion picture license in there. And I know that has something to do with it, and being more like something like a license for the pool or for dining. So I think that has to do with it, but I'm not 100% certain. But she would have the details on that. 1341, I think we can, but I think the quality is just so poor that it's the sound. It's just so bad that we've decided not to do that. It's really not. It sounds like a great idea, and I thought about it earlier. But until we till we switch over to everything with Spectrum and get this new digital channel. We're just not going to do that. As you know, Spectrum's been coming in and they've been changing out boxes. They were going to work in supportive living, had to nix that. So hopefully y'all see them come around, and they're all being screened. And I know Tommy and Brad's been helping with that, and Randy. I know that it moved really good at first, and there were some holdups, and it's moving again. So just bear with us on that. We're trying to get all the boxes switched out, and then will improve the quality here over 1341 as well. So the question is, did all the residents that test positive get sick and show symptoms, or some did not show symptoms? Staff. Goodness gracious. I'm struggling with staff and residents. So did all the staff that test positive, did they show symptoms and become sick, or just some did not show symptoms? And it's a little of both. I can tell you from here on my notes, there are 4 off the top of my head right here on this chart that were tested with no symptoms, and they still do not have symptoms. Actually, there's 4 that did not have symptoms when they were tested, and they did not have symptoms now. So that is a very good sign. It's a little scary telling how many people are walking around here, including y'all, myself. I've been tested, but that's just remember a moment in time. I could have it now. I tested 2 weeks ago. That's scary, but that's reality, and that's part of the testing. If we're going to retest, we're not going to retest because it's only for a short moment in time. So that's why we rely, after we do a mass test in the health center, to rely on the screening and the symptoms to test people and then isolate them. Again, we've had people that show symptoms after we did the mass testing. So 4 of them did not show symptoms and still do not have symptoms. So it's just kind of a mixed bag. It's about 50-50. So the question is, can this chart be posted on the bulletin board where the hospitalizations are? I do not see a reason why, but will be completely honest. I don't know the limitations of that board and what's supposed to go on there. I know there's one where people can put whatever they want, and then one that's only Springmore stuff, and some stuff is HIPAA. Carrie, do you know about bulletin boards and posting stuff? They're asking if the chart can be posted. I mean, I for sure don't care. It's just okay. I'll find out. I have no problem making sure you guys see that. It's like I said, it's internal information for y'all. I don't see why we can't do it, but again, I don't know all the specifics of that board and exactly what to do with it. But it seems pretty easy that we can put that down there. I think yes. But let me find out. The question is, do we think staff have been infecting each other, or have they been bringing in new cases from outside? There's no way to know. I think it's both. I think obviously a staff member brought it in originally. Then as staff members work with someone that's infected, obviously it spreads from there. Then the people that did not work with those people in the health center, then they test positive in supportive living. So they had to bring it in from the outside. Now there's 2 people being tested in supportive living. So I think it's both. I think it originally came in from the outside, and then once it got in, it spread to other employees and residents, and that's how it continues to spread. And then more people bring it in, which hits more people, then it spreads in more, and then it gets better, and somebody else brings it in. That's why I think realistically, if we can get the curve back down and flattened off, that realistically a case here and there is probably going to be common. I just don't, again, from how highly contagious it is and from how I've seen it spread so fast, that I just don't know how in the world to control it other than we just walk around in a bubble. And I've said that for 5 months. Today is the 6th of June. Will be 5 months since I sent out my first memo. So Yeah, July 6th. Golly. July 6th will be the 5th month that we've been dealing with this. So I saw my first memo I sent out was March 6th. That is 5 months, right? March to July. Okay, yeah. I'm at this point, I have no idea. So, so 5 months we've been tracking this, and it's just hard to tell. But I think that's my perception. I do read a lot about it. I'm not an expert on it, but it's you just got to use your common sense with it. It's like anything else. You're going to bring it in, it's going to spread, and it's going to get better, and somebody else is going to bring it in. I mean, unless we just close the doors, it's just what's going on in the whole world. 44,000 new cases, 1,800 North Carolina. It's reality, and it's terrible, and I want it to be over. And we're trying very hard to contain it and get over it, and we'll get through it, and I'll find a vaccine, but for right now, it's just tough. So what else we got? Can you be notified before Spectrum shows up to install your new box? I think you can. I thought Randy was doing that, but I am not sure. I know we had some weird phone calls about I'll be there between like 11 p.m. and 12 a.m., which is terrible, and of course that was not true. So I'll get Holly to check on that. I think that you can be called ahead of time. And I thought he was doing that, but I'll find out. Holly will find out. We'll put that in the memo for you guys, okay? It's a good question. So we had that this morning, even before we started quarantining people. We saw it's not funny. It's just so much. So many moving targets. It's impossible to think about everything. So if you see a supportive living resident out wandering past where they should be, call security and you call security and they'll take it from there. Either they'll come and escort them back, or they'll call down supportive living and send one of the staff members. Remember, they're staffed 24/7, so they have somebody down there all the time. They don't have two people down there all the time, but they always have at least one person. So between security and the staff, we'll get them back to where they need to be. So yeah, just like you do with a visitor, and just a friendly reminder to, again, no visitation. I would hope now y'all are not scared, but more heightened awareness more than ever of how quick it spreads, and to not think about letting a guest walk through this door ever. So I pray that y'all are doing that. I pray that nobody is coming into your apartment, walking down the hall. Please just abide by the visiting rules of being outside and social distancing and using the common space. I'm not hearing a lot of calls, knock on wood, about seeing people, but I really do beg you to please not let any visitors in. It's y'all can see it now. What we've been talking about for 4.5 months now is happening. So it was not a matter of if, it was when. So just remember that. All right, that's a lot of questions. Maybe the most we've ever had. All right, so I want to thank Lori and Carrie. I think they're a little better than Brad and Daniel. I don't know. They're just more organized. Lori was, it reminded me about the difference between staff and residents. And I heard Carrie say town hall. I don't know if Brad greets y'all that nice or not. I have no idea. Do we find out what a scullery was? I was just curious. Yeah, is this kind of like a dish room, or I thought I'd? Well, we're going to get this answer real quick. See, there's hope for me yet. I used a very intelligent word, I think is intelligent, called a scullery. Lori didn't know what it was. She got a master's in divinity. You got a doctorate? Are you a doctorate? Okay, well, she's a smart lady. And so I used the word scullery. So thanks to my previous bosses, Richard Fields, who's in Knoxville, Tennessee, taught me that term. He was an odd dude and a smart guy, but I learned a lot from him. So scullery is the word of the day. So hopefully we'll have that scullery fixed soon so we can get the new dishwasher in and get you guys some new, fresh, nice, clean dishes. So thank you again, seriously, for everything. Please know that we're trying the best we can with everything we're doing. I still feel extremely confident we're tackling it when it happens. It's just moving, and it changes every second, just like it does today. So we'll get this out to everybody. We'll get all the information out to your families by tomorrow, and we will see y'all next week. Have an awesome 4th of July. Have fun, be safe, and see you next week.